My name is Anna Nguyen, and I will be discussing the disease measles. So first, we must understand what measles is. Measles is a contagious disease caused by the measles virus, and it creates an infection in the respiratory system, immune system, and skin. Initial symptoms are high fever, runny nose, bloodshot eyes, and white spots on the inside of the mouth. It then develops into a rash that spreads downwards. So why does this problem exist? So measles is a highly contagious disease, so when people are not vaccinated, 90% of people they come into contact with will become infected. How did this happen? It happens through transmission through direct contact in the air. So things such as coughing and sneezing, or even just being in direct contact with one who is infected, can cause another person to be infected. Where did this happen? Measles first appeared in the 11th and 12th century when the measles virus diverged from the rinderpest virus in the Middle East. Currently, measles also occurs in places where people do not have high vaccine coverage. It can also be caused by international travel. This is when people who are infected come to another country and they are highly contagious and they spread it to other people in another country. And this is why measles can have big outbreaks in different places. This is also why the United States has seen recent outbreaks, even though the disease was declared to be eradicated in the early 2000s. What are the risks for the community in the future? There was actually a risk this year. In 2019, there was the most cases of measles in the US since 1992. This would be because of international travel and the anti-vaccination movements. There are a lot of people who are misinformed about vaccines and they believe that they could actually harm the body, so they do not want to get the vaccination. And since measles is highly contagious, this means that the disease can spread easily, which leads to high levels of hospitalization and death. This can lead to overcrowding in understaffed hospitals, and they might lose resources or they might not have enough resources to begin with. So what are the etiological factors? Measles can actually affect everybody, but it mostly affects people in underdeveloped countries. Again, when it spreads around, this would be because of international travel. And then also natural disasters can spread the disease. When there's a natural disaster, there is overcrowding in clinics, and it makes the disease easier to spread and also interrupts immunization routines. How to solve the public health problem? There's currently no specific treatment to combat the virus once you get it. However, we can still try to prevent measles by having vaccinations. It can be prevented with the MMR vaccine, which protects you from measles, mumps, and rubella. It is recommended to get 2 doses, one at ages 12 to 15 months and one at 4 to 6 years. This is shown to be 97% effective at preventing measles, and one dose is 93% effective. Vaccinations can cause herd immunity, which is when a lot of people are resistant to a disease, especially from vaccinations, and this helps out people who cannot get vaccinations. There's also campaigns for the vaccinations. There was one in Uganda this year in October where they administered the MMR vaccine to children in Uganda. Because it is an underdeveloped country, many people did not have the vaccination and there were measles outbreaks. With this, they can prevent many people from getting measles and also make people aware that there is something that can prevent measles. Also, just having basic hygiene, such as washing your hands often, sneezing into a tissue, can help prevent the spread of the disease. One example of prevention is when the Immunization Practices Advisory Committee recommended that children get, instead of 1 dose of the vaccine, they get 2 doses. And statistically, this has been proven to be effective. Another example of prevention was when the Global Partnership Measles Rubella Initiative worked in the Philippines this year to combat the 12,000 measles cases in February 2019. The hospitals were overcrowded during this, and people had to share beds, which is bad because it is highly contagious disease. The PRC set up measles care units. They had extra beds in emergency rooms for people suspected to have the disease, and they also vaccinated and educated people. And this is important for people to know. It is important for people to know what measles is so something like this will not happen again. So research suggests that the best way to prevent future spread of disease will be from the MMR vaccine. According to the CDC, 1 dose is 93% effective and 2 is 97% effective. We should also have safe environments for the vaccinations. There are certain temperature ranges, light exposure, and places within the refrigerator that keep the vaccine potent. I personally think that we should try to push for everyone to have vaccinations, except for those who physically cannot, such as people who are extremely sick with cancer, undergoing chemotherapy, or newborn babies. However, I know that this is really hard to do because There are a lot of anti-vaccination movements currently, and there are people who are misinformed and firm on their beliefs that vaccinations are harmful. But the best we can do with them is to try to inform them or provide them with real-life examples of people who have converted because they are more likely to believe them. And we should also have laws in place, such as the ones at UCI to enter kindergarten, that require all students to have their vaccinations. Thank you for watching my PowerPoint.